Imagine it's 1918. A young soldier named Harry returns home to Boston from the battlefields of World War I. Thinking the worst is over, but a new invisible enemy is waiting. Within days, he's battling a fever, a cough, and a terrifying illness that turns his skin blue. Harry, like millions of others, has contracted what would become known as the Spanish flu. This wasn't just any flu. It was a global catastrophe that infected about a third of the world's population and claimed at least 50 million lives. In the United States alone, over 675,000 people died. Cities were overwhelmed. Philadelphia tried to go ahead with a huge parade, and within days, its hospitals were overflowing and morgues ran out of space. In contrast, St. Louis closed schools, churches, and theaters early on, and their death rate was a fraction of Philadelphia's. It was a brutal, terrifying lesson. Before 1918, public health in America was a patchwork of local efforts with little coordination. There was no national strategy for dealing with a pandemic. The Spanish flu changed everything. It was a wake-up call that disease doesn't respect city limits or state lines. This crisis forced the creation of public health departments in many cities and states that didn't have them. It pushed scientists to intensify their research into influenza, leading to a better understanding of viruses and eventually the first flu vaccines in the 1940s. The concept of epidemiology tracking and studying diseases to control them became a cornerstone of modern medicine. People started to understand the importance of hygiene, quarantine, and public health measures in a way they never had before. Think about it. Every time you hear about pandemic preparedness, contact tracing, or the importance of vaccination, you rehearing the echoes of 1918, the tragic story of Harry and countless others was not in vain. Their suffering laid the foundation for the public health systems that protect us today, a powerful legacy born from one of history's darkest chapters. Thanks for watching. If you found this story interesting, hit that like button and subscribe for more deep dives into history. See you next time.